Good morning, everyone, and welcome to the WellMed Charitable Foundation Caregiver Teleconnection. We have a topic today entitled Difficult Situations and Elder Abuse. And we have an expert to present to us, Dr. Elliot Montgomery Sklar. He's a public health professional focused upon supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and on the web, which, as you know, worldwide. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, and his work is focused on the complexity of issues related to aging and caregiving. And with that, Dr. Sklar.
Thank you so much. Welcome, everyone, and thank you so much for joining us today. Lucy is not with us, and she asked that I specifically send her regrets. And as I mentioned, it's so nice to see so many familiar faces. It feels like we are building community, which I think is such a nice thing. So today we have some very important things to talk about in our learning objectives for structuring our program for today. We'll include discussion on difficult behaviors and how to handle them. We'll define advocacy in the context of patient care. We'll also talk about the signs of elder abuse and what to do. And we'll examine conflict in patient care and the role of communication, which is so important. And for those of you who are healthcare workers and would like a certificate of attendance, you can email your contact information to caregiverteleconnection@wellmed.net. We will also be providing a handout of our slides today, which we always do. They include some really great resources as well. So let's begin by talking about difficult behaviors. They may seem obvious to some people, especially if you are a caregiver for anyone that suffers any form of dementia and related Alzheimer's. And some examples, as we know, include agitation, mood swings are a big one, aggression, which can be both verbal and physical, and also challenging help with activities of daily living. We hear a lot from caregivers that their care recipients don't want to bathe or don't want assistance with doing things, and that can be very, very challenging. It's also very hard to deal with delusions and paranoia, wandering, sundowning. But I would also take it a step further and say that I think difficult behaviors can also arise when we feel a lack of trust with our healthcare providers or our caregivers, or when there are underlying tensions also among caregivers and care recipients. And we know that can be the case for caregivers who have perhaps just not had very good relationships previously with their care recipients. So that can be very challenging as well and very difficult for both parties. Difficult behavior is actually among the most challenging for caregivers and has a significant impact because the behavior of the care recipient is often unexpected. It might be out of character, and it's hard to know what action will cause a reaction. And that's key. And as a result of that, caregivers often feel quite helpless, frustrated, and angry, sometimes even confused or feel hurt because they just don't quite understand that they're not dealing with the person that they once knew. They're dealing with an illness, and that illness has behavior attached to it. So it's a very challenging thing. And as Evelyn mentioned, the WellMed Charitable Foundation has a number of programs that are dedicated specifically to only discussing this issue, because I think we could have a whole series on just difficult behaviors. But I have scoured through notes from input that we've received on previous sessions from healthcare workers and from caregivers. And we put together this list of 8 tips on things that people have shared with us that are also corroborated in the literature and research as having been helpful. And if it's a new situation or not, certainly make an appointment with a doctor for yourself or for your loved one, and sometimes for both. You might need some additional support, and sometimes the stress of dealing with someone who is exhibiting difficult behaviors can take a toll on our own health. So I think for healthcare workers, we discussed during our part 1 of this series the importance of recognizing the role of a caregiver. And sometimes they might also be a client or patient, and you might want to refer them if you see any red flags. But if a loved one or a care recipient has a medical problem, for example, a urinary tract infection, it can affect people both physically and mentally. And people don't often understand that a very common thing that seniors experience are UTIs that can cause confusion, delirium, dizziness. It can make you very tired, and it can change your behavior and your affect. Dehydration can actually do the same, and many people with Alzheimer's and related dementia are chronically dehydrated, and people don't recognize that. So these are important things to help with behavior, because believe it or not, these medical conditions actually do have an effect on people's behavior. And also sometimes starting a new medication, even an over-the-counter medication, can have a side effect that may result in behavior that we haven't seen before. If you've paid attention to news in the past few months, you might have seen that something as simple as Tylenol has been found to change our behavior. So it's quite important that we recognize that. And also to try to understand if there are triggers to the behaviors and patterns, if there's anything that perhaps could be avoided that might be triggering. I think it's also important to acknowledge and validate a person's frustration. Don't engage in argument, don't confront them. Rather, it's much better to try to mitigate the conflict by perhaps leaving the room for a few minutes, switching topics, going to the restroom so you can give yourself a moment or two to collect yourself. These are a lot of things that caregivers have shared with us that have been helpful for them. As well, maintaining familiar routines as much as possible helps to instill a sense of security. We've talked before, actually, during the pandemic about how many people found comfort rewatching old television shows that they had seen before. And that's because it helps to bring us a sense of comfort and familiarity. When we know what is about to happen on a television show, as an example, that actually does make us feel a little bit comforted. And that can be helpful as well if you know that there is a specific television show or something that your care recipient enjoys watching. Putting that on can be a great distraction or way to redirect that person. And that can also include music, perhaps having a snack, sometimes an aroma. Some people use aromatherapy and find that very helpful. A gentle hug, a reassuring caress. These are things that are very helpful. There's an old saying that, love is a great weapon, much more so than hate or anger. And I do believe that to be true. And as I mentioned before, when we recognize that we are dealing with difficult behaviors that are secondary to a health condition, that can sort of sometimes just help refocus where our frustration is. And I was curious to know if anyone had an example of a difficult behavior that you may have dealt with, or if you have any tips that you would like to share of how you've handled something or helped a caregiver handle something.
So at this point, folks, if you're on the phone, please unmute yourself by pressing *6, or you can unmute yourself on Zoom. Go to the chat room, put your hand up. I already have an open line for Anne. Anne, you want to talk to us? Anne Dakey?
Oh, are you there?
Yes.
Yes.
Oh, I'm sorry. I am a caregiver, and for 10 years been taking care of my mother, who's 102 now. And we are experiencing more and more of a mental decline. Whereas with my father, he had dementia, but this is different. Physically, her body's failing her, and we are dealing with severe anxiety now. And I'm struggling with, I feel like I'm running out of steam after 10 years. And I myself am a senior. And my mother and I have a history. We love each other. We're great friends. I've gone to her for things throughout life, but we have a yin and a yang. And I'm not feeling as patient as I feel like I should be. So I share that not because I know there's a cure for my problem, but it's gonna, by saying it out loud to the professionals, it's gonna help me refocus. And one of the things I've found that we don't make changes. It seems in caregiving, we don't make changes unless what I call an event happens. And by that, I mean a change in the routine. You can no longer function doing your daily routine. You have to make a change. And it takes an event to make you change. Like, I didn't like to use outside sitters, but now as a survival, because I can't do it anymore, I do that. So I wanted to share that with other caregivers, that beware of the signs when you have an event that says you need to make a change in how you care for this person. Hear it and get working on making that change happen.
I want to thank you so much for sharing that. Also, thank you for the role that you play in providing care for your mom. That's quite amazing. Certainly she would not be living to 102 without your support, and that's evident. I do have a question for you, and you might not have an answer, but it's something that I would encourage you to think about.
Okay.
What would help you feel like you can manage this better?
Gosh, I'm a very capable person that might be kind of, oh God, okay, we got this change. And then I'm like, okay, figure it out. And I educate myself. I look for resources. And I attend caregiver Zooms. And I've gotten really good at it. I always, even on topics that have been covered before, I always learn a nugget of new information, whether it's from the speaker or from the other caregivers that have a problem and they're trying to solve it. So I think I'm just I'm in burnout, if I'm honest. I'm in burnout, and it's very difficult to say that when you don't want to fail. You don't want to fail your parent because they've done so much for you growing up and made all kinds of sacrifices. I don't have, my family loves her. They're in touch, but my siblings still work full time. So I really don't have relief. And I'm being honest here, I'm part of the problem. I can't stand to leave her with people that I don't know and trust because I'm afraid they'll hurt her.
Mm-hmm.
You hear all these terrible things. But I have found one person that I trust, and we're working through. I'm working through trying to take care of Anne and put a plan in place for me. And I'm not used to doing that. I'm a giver. Obviously, I think most caregivers are givers in personality. And we don't take good care of ourselves. Physically, we don't take care of ourselves. Emotionally, and you get cut off from the outside world. And I've heard about this in other sessions. People talk about it. It's not new news. And you're isolated.
Mm-hmm.
You're isolated. So one of the things I do is attend these Zooms, and they give me kind of a shot of energy to keep going.
Good.
Keep going, because I know we're on the tail end of this. Hospice is in. She's on 24/7 oxygen, and I know, but it could be another year.
And I have a question for you.
Yes.
Have you talked to her doctor or the hospice doctor now about her anxiety? Because there's really good medication for anxiety now.
Yes, I've just done that, and finally got her to take lorazepam.
Good.
And
Okay.
last night was night 2 because the night before we had a horrible incident where her breathing, that she has trouble when she goes to bed,
Hmm.
she gets scared. I know she's scared, and it's like a panic attack.
Hmm.
And I secretly think she thinks so many people die in their sleep, and she doesn't want to get into bed, and she knows it's coming, and she has fought it tooth and nail. Even though spiritually she's in a great place. I mean,
Hmm.
I would like to be in her shoes spiritually. But so we are in another event change turmoil. I'm trying to, she's finally agreed to take lorazepam because she won't take anything new. She's a retired nurse, World War II veteran, and stubborn and feisty and loving and loyal and all those things that go with it.
All good
So
qualities.
all good qualities. So we're doing that, and then I'm increasing the amount of time I'm bringing a sitter in and saying it's time to take care of you, Ann,
Hmm.
or you're not going to make it. I'm
Right.
78. Come on, people, you know. So that's what I'm doing right now.
Elliot, do you want to take more questions now, or do you want to move on and take more later?
I just in the sake of time, we'll move forward. But
Yes.
I want to
Thank you.
Anne, I want to thank you for sharing with us so much and encourage you to get some help for yourself. You know, I think you recognize that you're the person that needs some care right now. So I would definitely, you know, I'm sure you're already making use of resources in your community, but through 211, you can certainly access your local area agency on aging. There are social workers and counselors that are accessible and available. And we also now have this national hotline, 988, which is a crisis hotline. But people can also use that to be able to vent. If I've had actually a really bad day, I have made use of that hotline once before, and you can actually text them as well, which is really amazing. So there are a lot of resources out there, and it is very challenging to serve in the role of a caregiver, especially for so long. So I thank you for everything that you're doing. And Trisha had said, I love how you framed events as teaching moments for caregivers to accept change. Thank you, Anne. You are teaching us. And you really are. And from the bit that you shared about your mom, sounds like the two of you are a little bit more similar than you think, perhaps. So we'll move forward, but I certainly will encourage you, Anne, and anyone else to participate and jump in as we go along. I wanted to talk a bit about difficult situations in healthcare. This is something we don't talk a lot about, and as a health educator myself, it is something that I think is incredibly important. Because while we know it's very important, obviously, to handle difficult patient behaviors, there are other difficult situations that I think caregivers, patients, but especially healthcare workers encounter when working with others. And these challenges can be different for different people, and they can be different at different times. For example, the challenges that we were all facing during the height of the beginning of the pandemic are very different than what we're experiencing now. But one of the challenges that comes to my mind, actually in light of the pandemic, is our increasing use of telehealth, which can be very challenging for older adults and caregivers, especially if there are hearing issues, vision issues, and also simply issues in knowing how to access technology. Now, sometimes you need to download an app in order to communicate with the provider as well, which can be a challenge. And if you've noticed, there's not a lot of training that goes alongside this transition to telehealth. It's assumed and expected that we all know how, which can be very frustrating. So in that sense, to me, our healthcare systems can be a bit unhealthy. And that can also add to sometimes tensions that exist between patients and providers. Simple things also like clinic wait times, waits for home care. There has actually recently been a lot of frustration in waiting rooms in offices because masks are no longer required in most states. And so it makes it impossible for a healthcare provider to ask or enforce that patients wear masks in waiting rooms, which has caused a lot of tension for caregivers. And I've seen it firsthand taking my grandmother for appointments, because people who are older or have who are immunocompromised, for example, still have great concerns about COVID, and we're still seeing more deaths from COVID than we are from flu. So that can be very, very frustrating and can heighten anxiety that we're already feeling in healthcare environments. Really, anything that might have gone wrong in the patient pathway to that appointment can also potentially lead to challenging interactions between a patient, a caregiver, and healthcare workers. And as healthcare workers, we're often the face for that frustration, especially when we consider the health status of older adults whose health conditions will only deteriorate and not improve. And perfect example is what Anne was explaining to us in the case of her mom and her declining health. And that's very frustrating because we put so much effort in to try to improve that person's quality of life. And we naturally want to see some improvement then in their healthcare. But that isn't necessarily the case as we advance in age. So all of these things can create tensions, challenges. They can also change our expectations, our perceptions, and our communication in the healthcare environment, which is also important for us to think about. And difficult situations can especially arise, I think, nowadays when people have done a lot of online research and have self-diagnosed their conditions, and they want to direct their treatment or ask for a medication by name. A lot of studies show that when we see ads for medications by name, we are more inclined to ask for them by name from our providers, whether or not we feel that, that they're necessary. And I included here this little snapshot below of something I use when I teach healthcare students. It says, feel free to Google your symptoms. And this was actually a billboard used by a health system. I believe it was in Ohio. And it drove traffic to their emergency rooms exponentially, because as soon as people Googled their symptoms, they got very anxious and rushed to the emergency room. So it's, doctors will often say, don't Google your symptoms, but that is human nature. And we have lived through the information age, and that's where we are. But sometimes we're not the expert, and there's a reason why people get the training that they do. So it's important that we, recognize these different levels of information. And we also need to be able to learn how to distinguish good information from bad information. And there's a lot of bad information about healthcare online. And that is an ongoing challenge, not only for caregivers and for patients, but also for healthcare workers, because it can confuse the things that a patient believes to be true. Now, sometimes the challenge can also occur when there is no diagnosis, but a person is feeling an impact to their quality of life or the quality of life of a caregiver. And despite tests and physicals and specialist input, there's no diagnosis, and frustration can occur. There's also a challenge of non-compliance between patients and caregivers. I spoke with a caregiver last week who was recounting an issue that she had with her mom, who's 88, and a caregiver to her father, who's 91 and has Alzheimer's. And all he is interested in eating right now is ice cream and fast food and junk food. And his daughter, whom I spoke with, felt at this point in his life, he should be able to enjoy whatever makes him happy. And her mother does not agree and feels that eating foods like blueberries and other things that are rich in antioxidants can have an impact on his cognition and his function. So they're at odds about how to proceed with his quality of life. But this can happen also between patients, caregivers, and physicians. I talked about dehydration as an example being a chronic issue. It is very important that we promote that people drink more fluids, especially as we age. But a lot of people don't like to do that. And that's just a simple example of non-compliance. But it is an issue, and doctors get very frustrated. And we saw this a lot during COVID when people were very reluctant to get vaccinated or to take proper precautions. And doctors felt like they were putting their lives on the line, and people were not being respectful of that.
Right.
So we're still living in a bit of that aftermath of that tension, that turmoil, and the stress that healthcare workers have gone through. Not to mention the fact that there are significant staffing shortages, which we're all, certainly experiencing to some degree. So there are a lot of issues and factors that are happening right now that I think we need to be mindful of, and that evolve. The challenges that are in existence today might not be the same as they are in a few months. So I think it's just something that it's important to be mindful of. And the other thing is that healthcare, as I said, makes people anxious. Myself especially, I have white coat syndrome, and as soon as I go into a healthcare setting, my blood pressure spikes, and I actually have to take photos of what my blood pressure is at home before I go to the doctor, so that they know that I'm okay. But this is especially true, I think, for a lot of people since COVID. And I talked a lot about some of the tensions in waiting rooms right now, because people feel like waiting rooms are breeding grounds for bacteria and infection. And if you're not wearing a mask, people feel like that is increasing that potential risk. And as I mentioned, there's more and more research coming out about how COVID has made people a lot more anxious about receiving healthcare. It has made people delay seeking out healthcare. And in turn, people are now more anxious because it's been longer since they last had a checkup or a routine test. So it's very important that we provide ways to access further information and support for patients. Some patients might also not take in all of the information that a healthcare worker is providing because of that anxiety. So I always recommend to patients to write things down, to write down your questions and take them with. But for healthcare workers, it might also be important that you ask someone to write down certain information or to recap things with a patient or caregiver before they leave, so that you make sure that everyone is on the same page about what you're thinking. And if you find that a patient is very anxious, a doctor did this with me once when I was in an urgent care setting, and it was very helpful. The doctor just kept asking me questions like, what did you have for lunch today? What are you having for dinner? What did you eat for breakfast? What do you think of this weather? And she just kept asking question after question. She didn't stop, and it actually really got my mind off of the fact that I was bleeding from my foot and needed stitches. So it was very helpful. Some doctors' practices are also using tapping, which is very simply just tapping your knee. It can help to actually change the way our brain processes anxiety and pain. There are a lot of interesting techniques. If Lucy were here with us today, she would talk about breathing as well. Taking deep breaths are a great way to help de-stress. But it's important, again, for healthcare workers to look for signs of physical distress, anxiety, any change in behavior or body language. I've noticed sometimes when I go to doctor's offices, if I'm very anxious, I'll tend to cross my arms. And I notice that that is a sign of me being a little bit more defensive. So I encourage healthcare workers to build connections with patients, which many of you already do, and to find common ground. It's very important to help reassure people because many of us experience anxiety as related to healthcare. And it again goes back to the things that Anne shared with us too, which I think are more common than people recognize. And again, thank you for sharing that. Does anyone have any healthcare experiences that they would like to share or anything that they want to add?
You can press *6 if you're on the phone, or unmute yourself, or go on chat, or put your hand up. I'll be able to see.
Sure, when I talk about anxiety, no one wants to talk.
Didn't take our meds yet.
no one's anxious to provide input.
I know, personally speaking, I can definitely relate to the white coat syndrome and the anxiety in the waiting room, but I know personally, and I feel like this is something that would likely impact caregivers and the care recipients, of course. I haven't heard any feedback from the caregivers I work with, but it can upset me sometimes if I go in anxious to a doctor's appointment and the doctor or any other medical staff will go, "What are you worried about? Just calm down. You know, there's nothing to be anxious about." I can only imagine for somebody with dementia or another chronic illness, they may not comprehend what that even means to begin with, but it very much belittles they or their caregivers' experiences and concerns going into the visit.
100%.
Yeah.
Excellent point, Morgan. And I would say that for us working in healthcare, the knowledge that we have actually makes our experience receiving healthcare sometimes more anxiety ridden, because we know of all the things that you could be worried about. So your comment certainly hits home with me, and I appreciate it.
This is Myra. Yeah, and I just want to add, because now as you started talking, I get a lot of anxiety. I'm a caregiver for my mom, single caregiver for my mom who has Alzheimer's, who's 84, and also has cancer. So in the past, my mother was one of these very difficult individuals about going to hospitals or doctors, and she definitely goes postal if she has to wait, or she wants to go home, or she's hungry. So that is a lot of anxiety for me. And I kind of get PTSD from the past. So I do everything I can, like Anne, to take care of her because I dread having to go to the hospital. But that is really challenging, right? And the one thing that I got to say to the health professionals, which I value so much, is that they always have to tell them what they're going to do. And I'm like, just put the shot, just do the needle, because if you tell her at that moment, she's getting agitated. So I just wish that when it came to an Alzheimer's patient, maybe they would learn to talk to them a different way or say the little fibs on what it is that they're going to do, because I know they I guess legally they have to tell them, but it's only going to make them more aggressive.
Excellent point. And there are ways around that. But this is part of the problem, is that we really don't adequately train our healthcare workers on how to deal with seniors, people who are experiencing Alzheimer's and related dementia, but also especially caregivers too. And the observations that you share would have great implication for the care that your parent receives. So these are such great points, and I thank you so much for sharing them.
Anybody else?
Well, I will move on because I am, again, sensitive to our time today. In sum, obviously, communication is very critical for all the reasons that we have discussed. But I want to, again, re-emphasize the importance of nonverbal communication, of writing things down, of looking at body posture, eye contact, gesturing. These are all very important, especially when dealing with patients with Alzheimer's and related dementia. Their body language, things that can, cause agitation. This is where the role of a caregiver is, I think, so important. And Mayra, the comment that you just made about that clinical care environment and not needing to necessarily disclose everything that might trigger some level of anxiety is an excellent, excellent point. I do think it's really important for caregivers to make sure that you write down any questions, again, that you have, and any notes or anything that you learn from that encounter or visit. Some doctors might even be open to you recording things on your phone so that you have a record of the exchange. And that's something you can ask in advance. But I think this is all of the experiences that have been shared today just bring this point home and emphasize it. And I have so many slides on it because it's something I can't emphasize enough, is that we don't communicate always the way that we need to with our patients, with our caregivers, with our healthcare providers. One of the things that happens as a result, and this is something that's gaining more attention, is medical gaslighting. And this is something that I have felt is very important for us to bring into this conversation, because it has been gaining attention both in the general public, but also in the medical community. And medical gaslighting disproportionately affects women of color, women, geriatric patients, any minority group, LGBTQ plus individuals. Studies have also found, for example, that women are more likely than men to be misdiagnosed with certain conditions, like autoimmune disorders, heart disease, and they will often wait longer for a diagnosis. One group of researchers had discovered that doctors were more likely to use negative descriptors like non-compliant or agitated in Black patients' health records than in those of white patients, a practice that could also lead to healthcare disparities. And it's something that is tied to advocacy, which we'll talk about in a few minutes. So what are the signs of medical gaslighting? They include if your provider, for example, interrupts you or doesn't allow you to elaborate, or doesn't appear to be an engaged listener when you're talking about your health concerns. If your provider downplays or minimizes your symptoms, or, for example, questions the extent of your pain. Pain is a big issue these days because providers don't want to prescribe pain medication. But pain exists, and pain certainly affects our quality of life. And back to talking about behavior, pain makes people behave badly because you're uncomfortable. So this is something that we need to really be able to communicate better about, and for our providers to understand if our pain is impacting our quality of life. Sometimes a provider will refuse to discuss treatment options or to refer you, and that is also part of medical gaslighting. Not ordering imaging or lab work that you would like to have ordered to confirm or rule out a diagnosis. If you feel that your provider is being rude or condescending or belittling, or the one that particularly hits home for me with a lot of people is if your symptoms are blamed on mental illness, but you're not provided with a referral for a mental health provider. That's a big one because doctors will often say, this could be functional, this could be maybe you're feeling down or going through a tough time. But if they then don't refer you for help through that emotional difficulty, that is a perfect example of medical gaslighting. So what can we do to advocate for ourselves and for our care recipients? And this is really where I think healthcare workers need to step in to make sure that they can help to bridge communication between patients, providers, and caregivers. This is so important. We all want to be heard and understood, but we also need to remember that the same is true for patients and caregivers. And I think this is a really good segue to discussing elder abuse, actually, because elder abuse can take many forms. For example, physical abuse, even if the care recipient sometimes abuses their caregiver, which we're hearing a lot as well. And also sometimes self-neglect, or that self-neglect for me is a big one because it can be either a form of elder abuse, but also a sign of depression. So I think we've all heard tales from long care facilities about elder abuse, even sexual abuse. We've heard from caregivers who are afraid to place their loved ones in long-term care or even have in-home health aides. And it's important that we're mindful of these concerns, but also mindful of the signs of abuse. Those can include bruises, cuts, abrasions, physical signs of trauma. And they can sometimes, as I said, be confused for depression. So it's important to certainly seek out professional care if there is any concern. If a senior's financial situation suddenly changes for the worse, if you're noticing poor hygiene, weight loss, bed sores, injury to private parts, self-doubt or unwillingness to speak. If you notice any of these signs, we've all heard, see something, say something. It's very, very important. So who do you say something to? And that is a big area of confusion. The impact of health, the impact by health professionals in recognizing and reporting elder abuse is actually quite profound and sometimes confused. Certain healthcare workers perceive it to be one person's responsibility over another. And it's interesting because in certain studies, nurses tended to perceive elder abuse as uncommon and generally didn't feel it was within their role, nor did they have the time to assess patients for abuse. They relied upon physicians to detect and report elder abuse. But physicians felt that other patient care issues, time limitations, and maintaining trust in the clinician-patient relationship outweighed the importance of detecting and pursuing suspected cases of abuse. And they relied upon social workers. And social workers, although they're the most knowledgeable and experienced in regards to elder abuse at times, relied upon nurses and physicians in this national study to detect abusive situations and make appropriate referrals back to them as social workers if the case warranted. So it's very interesting because I also teach nurses, doctors, future doctors, physician assistants or physician associates, and social work students. And I discuss this with all of them because everyone has a different perspective on who is responsible. But ultimately, it's all parties involved because if you see something, you need to say something. And if you think about the fact that the average primary care appointment last year only lasted 18 minutes. So think about that. In 18 minutes, it's very hard to properly assess and have candid conversations about potential abuse. So that's a bit of a challenge there too. So I want to tell everyone that if you suspect elder abuse and you suspect that there is imminent danger, call the police or 911. But if the danger is not immediate, which is often the case with elder abuse, you need to tell someone. Now, you might want to find out if you're a healthcare worker, what the protocol is within your specific organization, or if your organization has assessment tools or an internal process to follow. You can also relay your concerns to local adult protective services, the long-term care ombudsman, or as I mentioned, the police, and we have the number for the elder care locator here, and additional resources on this next slide. And as I mentioned, you don't need to worry about writing anything down. We'll be giving all of this to you. I know we only have a few minutes left, but I did want to stop and ask if anyone had any specific questions.
*6 if you're on the phone, or unmute yourself. Elliot, I don't know if you saw it, but one of the big universities did a study on physician requirements and the amount of time that they have in clinic visits. And it said basically physicians need to work they need to have 27-hour work days to fulfill all the requirements that are put upon them.
Yeah.
Well, no wonder.
It's very challenging, and it is impacting the care that patients receive, for sure.
So folks, we've had a lot of good information here. Questions, comments, your experiences? I'd love to hear from you. You'll notice in our podcast that some of the best things that we learn are from other caregivers.
Well, while you all think about it, I will continue and wrap up the rest of our presentation today. I do see a comment here in the chat. Are there any good resources like practice guidelines for healthcare providers to learn to interact better with people who have dementia? Excellent question. And yes, the Alzheimer's Association does have resources, as well as all of the health professions, which require continuing education. So the thing of it is not all professionals seek out the same continuing education or have the same interests. So you can get continuing education credits in any number of different areas. But I think one of the ongoing challenges is that gerontology just doesn't seem very appealing for many people. And so we need to, I think, do a better job of driving the importance of us better understanding how to work with people who are aging, because as a population, we are aging. And we're also now, as a population, having children later in life, having less children. That means that there will be less caregiving responsibilities to share around as we age. So there's a domino effect of these things, and we need to be paying attention.
Well put.
Thank you. And I will say that we will be providing an additional list of resources at the end of this program, which will likely have some of those Alzheimer's focused resources that you're looking for. So I'm going to quickly talk about advocacy, because now that we're done with elder abuse, we need to know how to advocate, right? So we have some formal definitions of advocacy here, but I think everyone probably has their own perspective of what advocacy actually is. And what is the role of healthcare workers in advocating for their patients? I spent the majority of my medical career teaching, I've been teaching all morning. I spent the majority of my teaching career teaching medical students. And medical students take the Hippocratic Oath when they graduate. And we know that the Hippocratic Oath says to first do no harm. So when you see something is wrong and you do nothing about it, in my opinion, that's harmful. So I see advocacy very directly in that regard. What was very interesting for me when I began teaching osteopathic medical students is that they take a different oath. And their oath says, and I quote, "I will be mindful always of my great responsibility to preserve the health and the life of my patients, to retain their confidence and respect, both as a physician and a friend who will guard their secrets with scrupulous honor and fidelity, to perform faithfully my professional duties, to employ only those recognized methods of treatment consistent with good judgment and with my skill and ability, keeping in mind always nature's laws and the body's inherent capacity for recovery." And I share that oath because when I heard it for the first time, I just felt it just stuck with me, because I thought it was such a comprehensive way of addressing advocacy, also the importance of communication, being a friend to a person that you are providing care to. And I think it's just one that we keep in mind, because it is a very important function of our role as healthcare workers, is to really support the integrity of a relationship between people. And part of that is advocacy. So how do you advocate if you don't know what you're advocating for or whom you're advocating to? We have some excellent resources here, but every state has an aging services division dedicated to providing seniors with services in their respective communities. And those include transportation, counseling, advocacy, and legal aid. I think it would also be, I would be remiss not to mention the Ombudsman Office, which is a statewide office created under the authority of the Older Americans Act. And the Office of the Ombudsman has the responsibility and authority to investigate and resolve complaints from seniors and their family members regarding the quality of care in long-term care facilities and even dementia daycare programs. So again, through the links provided here, you can access information for your local ombudsman office. I'm going to flip to our last slide, which provides resources, and open it up for any last questions before I hand it back over to Evelyn for some announcements. And the Alzheimer's Association's Education Center link is here on this page, which does have information for healthcare workers on how to better communicate with patients who have Alzheimer's and related dementia. So, any last questions or comments?
You've got a chat or two here.
Okay. What if the elder is taken from your care to another state? Ongoing offsets of dementia. And whenever you call adult protective services, hold on, they go and the perp denies, and the elder feels that they have to say he's okay. The perpetrator being the youngest daughter seeking guardianship and conservatorship and approved. Okay, that's a very complex question that I wish I had the time to get into. But my suggestion would be to reach out to the ombudsman in your community and also the community of where your loved one is located. See if you can get them involved potentially. And I say the ombudsman only because you're talking about some legal things here, but also the AAA in these communities. See if they can help orient you to legal aid or to any advocacy related services or people that or stakeholders really that they can help to put you in touch with.
And if you've made a referral to APS or the police or one of the official agencies, oftentimes the district attorney will pick up these cases because they can go well above and beyond. APS actually has no entry into a home without a policeman going with them. And even then, if people refuse, they don't have it. But a district attorney does subpoenas. It's a whole different story. So you may need to use that.
And the power of documentation and evidence. Keep that in mind as well.
Right.
Well,
Okay.
I hope I will just leave off by saying I have included a hyperlink here on the left of your screen to our program next week, which will be focusing on the importance of cultural competence and sensitivity in healthcare environments, including long-term care. The session will be focused on what professionals and caregivers need to know, but we'll also be including some new data and research that's just come out about how different cultural groups grieve differently. We always refresh our programs, even if the titles are the same always, with the new latest information that comes out. And I want to thank you all so much for participating today.
And you probably all know that Elliot is the best at providing updated information and resources. He's the master. And with that, let me just do a few closing remarks. Those resources will get to you if you've actually registered for this session. If you got the number or the Zoom link from somebody else, you'll need to call our customer service representative at WellMed Charitable Foundation, and that's 866-390-6491. 866-390-6491 and get registered. And once you do that, you not only are going to get these resources, you're going to get the monthly calendar, which has a full calendar. Boy, you should see March is coming up. Oh man, there's so many good things going to happen. So do that. I'd like to thank all of you, for attending, and hope that you'll fill out that post-session questionnaire, which will come with the resources because it helps us improve, what we're doing here. I'm going to tell you a little bit about some of the new sessions coming up this month, and it's a short month, so there aren't too many, but we are going to continue Elliot's and Lucy's program for professionals next Thursday, and that's on diversity and caregiving. And then after that, we have, I'm going to do one on isolation and caregiving. We had somebody talk about isolation, which is, well, let me just say this. Isolation is as bad as smoking 7 cigarettes a day or being morbidly obese in terms of your mortality. So it's one of the things, it's an epidemic these days, especially with caregivers. So you want to tune into that. We'll give you some resources. And then there's another one by Jamie Heisman, and that's on Thursday, the 23rd. Can we honestly say that we love ourselves? And he does a lot of really introspective stuff that I think folks are very happy when they hear about it. Teaches us how to calm down, be real, be impeccable with our word. And then at the last one, Tuesday, February 28th, Encouraging Words Matter with Cynthia Hazel. And she's done a lot of stuff for us in the past on mindfulness and gratitude and things that, we can give other people and ourselves, to have a better life, better quality of life. So I encourage you to sign up for any and all of those. And Elliot, I think we have time for one more question.
I'm here. Any comments or questions, anyone?
Let's see, something on chat. Oh, yes, so nice. Thank you, folks. Thank you all for what you do, and please have a good day, a safe day. Take good care of yourselves. Remember, you're number one. You can't take care of somebody else unless you're taking care of you. Well, thanks for what you do. And I'm going to stop the recording, and thank you all so much. Let's see here. If I can figure